common ways to help overcome struggles that patients have with regard to taking their medication and how it fits into their schedule is making it a part of their daily routine. Initially, that might be difficult if you're not accustomed to stopping what you're doing to take a medication or more than one medication. So initially, even if it's a medicine that you've been taking a particular period of time, but it's been once a day, and now when it goes to twice a day, that might become difficult because it is entering a different time of day and having to figure out, well, when am I going to do that? So things that I recommend for folks who do have those types of problems is a medication calendar. So this is something that for a few months or maybe indefinitely somebody would have, and they would come, when they take their morning pills, they can check Monday morning I took my medicine, Monday in the afternoon I took my medicine. And then you would put a list of the medications on one side so you would know, well, which ones do I take in the morning compared to which ones do I take in the afternoon or in the evening. And then once done, you just check it off. And then if this is placed somewhere near a patient's daily routine, it just becomes over time habit, and then you can withdraw the calendar and having to check it because it becomes so part of the routine. But initially it may help folks identify, over the past week I may have missed 3 p.m. doses but none of my morning doses, so let's focus on what's going on in the p.m. that's problematic for medication taking. And in some of those situations it may be that you're at a different part of the house, or you might be out and about in the evening, and so there just isn't we have medication boxes, pill reminders that can be set up Sunday through Saturday. With the PM medications, you can use multiple pill boxes. Sometimes you can get them AM, noon, and PM, and by filling them up, you can just have something very quick that you can grab and take with you when you're heading out. Or if you want to put the medications in a different part of it. When medications are prescribed, for example, once a day versus twice a day versus 3 times a day, sometimes it may matter if you take it in the morning and in the evening, if you take it 12 hours apart versus just breakfast and dinner, which may or may not be 12 hours apart. It really depends on the kind of medication. Adhering to the prescribed directions most of the time is the way to go. Sometimes if that is problematic, we can talk to the doctor about changing it to an extended release. Other times we just have to work at getting that second dose in, or maybe even consider changing it to a drug that might be a little bit different but might do the same job. So there are options when it comes to searching for a medication that will fit your specific regimen, especially if you have a very difficult, kind of busy